Imagine your mom has breast cancer and she's positive for a pathogenic gene variant. She calls it her BRCA mutation and tells you it caused her breast cancer. Your doctor wants to test you for the exact BRCA mutation your mom has, but it's hard to get a copy of her genetic test report. So your doctor just orders you a full genetic panel for hereditary breast cancer. Results come in and you meet with your doctor, who explains, you have a variant, but it must be a different variant than your mom's because yours is a variant of uncertain significance. Most variants like these are eventually updated to be benign. So that's good news. Nothing to act on. You snap a picture of your test report to refer to later. 6 months go by and your mom finally shows you her positive genetic test report. She's already had a bilateral mastectomy because of her BRCA mutation. You pull up the photo of your own genetic test result. You feel your stomach drop. It's the same genetic variant, but the reports don't match. One result says positive, and one says variant of uncertain significance. You also notice the genetic tests were done at 2 different labs. So how can these results be different? Which result is correct? Today we will be diving into genetic variant classification. What might cause 2 labs to report the same genetic variant differently? To talk with us today is Dr. Bryan Gall, PhD, a clinical variant curation team supervisor working in the clinical genomic testing space, who specializes in clinical variant interpretation.
Variant interpretation has been the Achilles heel of genetic testing. I also like to think of it as the bottleneck of genetic testing.
Dr. Gall touches on who is invested in the accuracy of variant interpretation.
Not only does a quality variant interpretation support good patient care, it helps companies that actually provide this testing, it helps the companies that provide the supplies, and furthermore, it helps the people who are actually paying for it all and insurers. And that's why people in the insurance industry may ultimately be some of the drivers towards increased quality care in the genetic industry.
Though the ACMG guidelines provide a foundation for variant interpretation, the art of variant interpretation is not fully objective, and Dr. Gall discusses how discordance can arise.
It does all seem very regimented based on that rubric. But the fact of the matter is, a lot of times in science, there is that degree of subjectivity where certain rules or certain papers or case studies don't necessarily fall into that perfect little box. And because of that, we do see a lot of, I shouldn't say a lot, but a good amount of subjectivity in our industry. Some of the key factors that actually cause this discrepancy between labs are some issues where, like I had mentioned, the ACMG guidelines are now over 5 years old. So a lot of labs that have been using those ACMG guidelines have kind of modified them individually. And they're not necessarily well published how they are modifying those guidelines that could very well swing the interpretation of a variant from non-pathogenic to pathogenic of some sort.
Genetics has increasingly become a booming industry. Dr. Gall addresses quality trends that may come into play for variant interpretation competencies as the industry has expanded.
A lot of your more well-known labs are typically going to have some sort of internal competency evaluation, but there are a lot of newer labs out there that we just don't know what level of quality control they're doing as far as the interpretation analysis. A lot of times these individual labs are sort of black boxes where you don't necessarily know what one genetic testing company is using as their modified guidelines, and they may not want to disclose that information to other labs because it gives them a competitive advantage. And a lot of times too, there's just not much crosstalk between labs. And that's really why groups like the expert panels are really, really positive in my opinion, because not only does it allow you to come up with a centralized interpretation for a variant, but it also kind of forces people from different industries and different companies to kind of work together towards creating this.
Dr. Gall discusses how AI has been a game changer for variant interpretation, but still is considered a scientific tool versus a competitor in the eyes of variant interpretation scientists due to some of the limitations of AI.
AI is a huge boost to what we do. You can train an AI to actually look for your variant of interest throughout the literature. And it can just search all the text and say, oh, hey, I found your information right here. This paper is probably useful for you. Here you go. This saves us hours of looking through the internet for basically Googling, or the scientific version of Google, which is PubMed, these variants for hours and hours and only coming out with a few papers. This ultimately allows variant interpretation scientists to have more time to actually dig into the literature and kind of interpret those data in the context of each individual variant. So it gives us more time to actually look into the data that AI can't necessarily interpret at this point. So artificial intelligence is really good at pulling out key phrases, but we haven't really gotten it to the point where it's great at understanding what those key phrases mean. To date, they haven't really perfected the ability to identify, let's say, a paper that says, hey, there's this person affected with this disease and they're a homozygote for this variant. It's something that, as of now, we still need the human input to actually determine whether or not those type of situations exist. So as of now, that's really what's holding back artificial intelligence, is kind of that lack of a consensus and the difficulty of interpreting scientific literature.
Dr. Gall emphasizes that quality care extends into variant interpretation practices and should be an approachable topic for all involved. He shares how we can all raise the tide when it comes to genetic variant interpretation practices.
We still need that human input, and you need a quality oversight in how you're doing your variant interpretation. And that's for patient safety. That's also for your company's safety, in all honesty, because one missed diagnosis can dramatically affect a patient's life and can result in pretty significant lawsuits. A lot of ways that we can raise the tide together is as simple as asking questions. As a patient, don't be afraid to ask questions of your doctor or your genetic counselor. If you're a physician, ask questions of the test provider. As scientists, we're all really, really interested in talking about what we do. I mean, it's really why we invested so much time. So take advantage of that. Ask questions. On the business side of things, if you're an executive or some sort of shareholder in a genetics company, really try to talk to the scientists who are on the ground kind of developing these tests. I really think that we need, as businessmen and scientists, to kind of come together and collaborate more than is normal.
Please follow the links to freely listen or view the full podcast presented by the Center for Genomic Interpretation, a 501c3 nonprofit organization that works with precision medicine stakeholders to help them realize value and improve patient safety in clinical genetics, genomics, and precision medicine.